Welcome to Kinglaty Documentary. In the heart of Pennsylvania, a growing issue quietly impacts thousands of lives. An issue that is often overlooked yet undeniable in its presence. It is a story that echoes through the streets of Philadelphia and Pittsburgh, in the suburbs, and in the very lives of families and individuals who struggle to find a stable home. The issue of homelessness in Pennsylvania is more complex than a mere lack of shelter. It is deeply rooted in economic, social, and health-related factors that continue to affect people from all walks of life. As we take a closer look at this pressing matter, we not only want to understand the causes and consequences, but also explore potential solutions. However, to truly grasp the urgency of addressing homelessness, it is essential to start by acknowledging the scope and gravity of the issue. The current state of homelessness in Pennsylvania. Homelessness in Pennsylvania has become an increasingly urgent issue in recent years, reaching alarming levels in both urban and rural areas. In 2025, it was reported that approximately 15,000 individuals were homeless across the state, a significant increase compared to previous years. While the largest numbers of homeless individuals are concentrated in major urban centers like Philadelphia and Pittsburgh, where an estimated 6,000 people live without permanent housing, the crisis is not confined to the cities. Rural areas and smaller suburban communities are also struggling with rising rates of homelessness, often without the resources or infrastructure to effectively address the issue. This widespread concern has forced the state to recognize that homelessness is not just an urban problem, but a statewide crisis requiring comprehensive action. A particularly troubling aspect of the situation is the rise in the number of homeless children. In 2024, data from the Pennsylvania Department of Education revealed that over 35,000 students were reported as homeless in the state, an alarming figure that continues to grow. These children often face severe disruptions in their education, frequently changing schools or lacking the stability to focus on their studies. In addition to educational challenges, homeless children also face significant health risks, including inadequate access to health care, proper nutrition, and a safe living environment. This combination of factors creates a cycle of disadvantage that can persist into adulthood, trapping future generations in poverty and homelessness. The rise in homelessness is largely driven by several key factors, including a severe shortage of affordable housing, economic instability, and the increasing difficulty in accessing mental health and addiction services. In Pennsylvania, the cost of rent has surged by nearly 10% in the last 5 years, making it even more difficult for low-income individuals and families to maintain stable housing. As the state grapples with these challenges, it is clear that the crisis is not only affecting adults, but is also increasingly impacting vulnerable children who, in many cases, are caught in a system that does not offer them the support they need. The growing number of homeless children highlights the urgent need for solutions that address both the immediate needs of these individuals and the long-term structural issues contributing to homelessness. The rise in homelessness in Pennsylvania is driven by a combination of complex, interconnected factors that create a dire situation for many individuals and families. One of the most significant contributors to homelessness is the severe shortage of affordable housing. As housing costs across Pennsylvania, especially in cities like Philadelphia and Pittsburgh, have risen dramatically, the affordability gap has widened, leaving low-income residents increasingly unable to keep up. With limited affordable options, many people in marginalized communities, including single parents, the elderly, and those with disabilities, find themselves either living paycheck to paycheck or forced to choose between paying for housing, healthcare, and food. Economic factors also play a crucial role in exacerbating homelessness. The COVID-19 pandemic has had a lasting effect on Pennsylvania's economy, resulting in widespread job losses, business closures, and financial instability. For many individuals already living on the edge, losing their job, often without access to sufficient unemployment benefits, can quickly lead to eviction. This transition from stable housing to homelessness is often sudden and jarring, highlighting how vulnerable people are to unforeseen circumstances. In addition to economic stress, mental health issues and substance abuse are deeply intertwined with homelessness. Mental health disorders such as anxiety, depression, PTSD, and schizophrenia are prevalent among the homeless population. Many of these individuals cannot access appropriate care due to a lack of affordable mental health services, leaving them to struggle with their conditions on the streets or in temporary shelters. Substance abuse, particularly related to opioids and other addictive substances, has compounded the problem, driving many deeper into homelessness. The opioid crisis has ravaged communities in Pennsylvania, and for some, addiction has worsened their social isolation and deteriorated their quality of life. Perhaps most troubling is the significant lack of accessible support services. While various programs exist to help people experiencing homelessness, these services are often underfunded, overstretched, and difficult to access due to bureaucratic barriers. Shelters and emergency housing programs are not always sufficient to meet the growing demand, and many individuals are unaware of the assistance available to them. As a result, a growing number of people find themselves slipping through the cracks, unable to receive the help they need to regain their footing. The consequences of homelessness in Pennsylvania extend far beyond the immediate suffering of those experiencing it. They ripple through society, creating challenges that affect the economy, healthcare system, and social fabric. For individuals facing homelessness, the physical toll is profound. Without access to basic health care and sanitary living conditions, homeless people are more vulnerable to a range of health problems, including chronic illnesses, infections, and respiratory issues exacerbated by exposure to the elements. Overcrowded shelters and unsanitary conditions often lead to the spread of diseases such as tuberculosis and hepatitis. The lack of regular access to hygiene, nutrition, and health services creates a cycle of illness that is difficult to escape, leaving individuals trapped in poor health, which only exacerbates their situation. Mental health problems are another pervasive issue among the homeless population. The constant stress, fear, and uncertainty of living without a home contribute significantly to the development and worsening of mental health disorders. Anxiety, depression, and post-traumatic stress disorder are common conditions that arise from the traumatic experience of homelessness. Many individuals have previously experienced abuse, loss, or mental health challenges that led to their current situation, and the ongoing stress of surviving without shelter only compounds these issues. The lack of a stable, supportive environment leaves people feeling isolated and hopeless, further worsening their mental health. Many homeless individuals also turn to substance abuse as a coping mechanism, using drugs or alcohol to numb the emotional pain and stress of their circumstances. However, substance abuse often becomes a vicious cycle, reinforcing their homelessness and making it even harder to break free from their predicament. From a broader societal perspective, homelessness places a significant strain on public resources, social services, and local communities. Addressing this crisis requires a collective effort to implement sustainable solutions that provide long-term support and break the cycle of homelessness in Pennsylvania. Local governments and municipalities must allocate considerable funds toward providing emergency services such as healthcare, shelters, and law enforcement. While these resources are crucial, their allocation often diverts funding from other essential sectors like education, infrastructure development, and public safety. This imbalance can have long-term negative effects on the community, creating a ripple effect that impacts everyone. Additionally, homelessness has a severe economic impact. Individuals without stable housing often struggle to secure steady employment due to the lack of a permanent address and the instability of their living conditions. This increases their reliance on government assistance and welfare programs, placing additional pressure on public resources and finances. As a result, homelessness is not just a humanitarian crisis, it also becomes a persistent economic burden, making it even more challenging to break the cycle of poverty. The ongoing existence of homelessness puts immense strain on both the individuals experiencing it and the social systems designed to help them. Addressing homelessness is a complex challenge that requires a comprehensive, multi-layered approach. It must consider both the immediate needs of those affected and the long-term factors contributing to their situation. One of the most urgent issues is the lack of affordable housing, a widespread problem across Pennsylvania and many other states. The soaring cost of rent and home prices makes it increasingly difficult for low-income individuals and families to secure stable housing. To combat this, the state must not only invest in constructing more affordable housing units, but also create policies that incentivize private developers to build low-cost homes. Financial programs such as rent subsidies and housing vouchers could significantly improve housing accessibility, reducing the likelihood of eviction and preventing homelessness from escalating. In addition to housing, healthcare services, especially mental health care and addiction treatment, must be integrated into the solution. A significant number of homeless individuals suffer from untreated mental health disorders or substance abuse issues. Without proper medical and psychological support, these individuals struggle to regain stability, trapping them in a cycle of homelessness. Expanding access to mental health services and increasing the availability of addiction treatment facilities would provide much-needed care. Moreover, education and job training are critical components of a long-term solution. Providing homeless individuals with opportunities for education and skill building will equip them with the tools necessary to secure stable employment. By partnering with local educational institutions, businesses, and nonprofits, the state can create programs that offer job training, resume-building workshops, and direct employment opportunities, helping individuals achieve financial independence. However, no solution can be effective without collaboration. Government agencies, local communities, nonprofits, and service providers must work together to create a cohesive support system for those at risk of homelessness. Coordinating resources among these groups ensures that individuals receive the necessary help, whether in the form of housing, healthcare, job placement, or emotional support. Only through a collaborative and holistic approach can homelessness be reduced, giving people a fair chance to rebuild their lives. Housing and social welfare policies in Pennsylvania. Pennsylvania has implemented various policies to combat homelessness, but the challenge remains far from resolved. One of the primary obstacles is the severe shortage of affordable housing, which remains a significant barrier for individuals and families at risk of homelessness. Despite financial aid and assistance programs, the escalating cost of housing, particularly in urban areas, has outpaced these efforts, leaving many residents struggling to meet basic living expenses. In recent years, the state has introduced several programs designed to provide relief for those facing housing instability. These initiatives include rental assistance programs aimed at preventing eviction, emergency shelters for individuals and families, and short-term housing options for those who have lost their homes. While these services offer critical support, they often fail to meet the growing demand. Waiting lists for shelters and affordable housing programs are long, and the lack of sustainable, long-term housing solutions perpetuates a cycle of temporary fixes without lasting change. Social welfare programs, though well-intentioned, also face limitations. Many individuals experiencing homelessness encounter challenges in accessing services. Mental health care, addiction treatment, and employment programs that could help them regain stability are often in short supply or difficult to navigate due to bureaucratic hurdles. Additionally, many people at risk of homelessness are unaware of the assistance available to them due to inadequate outreach or a lack of resources to seek help. Ultimately, while Pennsylvania has taken steps to address homelessness, the current system does not provide comprehensive long-term solutions. A more integrated approach, including increased affordable housing, better access to social services, and enhanced outreach efforts, is necessary to break the cycle of homelessness and help individuals regain independence. A personal story: Belle's journey. To truly understand the impact of homelessness, consider the story of Belle, a 42-year-old woman from Philadelphia. Her experience serves as a poignant reminder of the human side of this crisis. Belle was once a successful professional with a steady income and a home of her own. However, a series of unfortunate events, including losing her job, going through a painful divorce, and falling into deep depression, led her to homelessness. For months, she lived in a shelter, struggling to maintain her dignity and sense of self-worth. But Belle's story didn't end there. After reaching out to local charities and support programs, she was able to receive mental health care and addiction treatment. Slowly but surely, she regained control of her life. With job training and the help of a community-based organization, Belle was able to secure stable employment and eventually move into her own apartment. Today, she's an advocate for homeless individuals, sharing her story and encouraging others not to give up hope. Belle's story is not unique, but it is a powerful testament to the resilience of the human spirit and the impact that the right support can have. It shows that with access to housing, healthcare, and community support, individuals can overcome even the most difficult of circumstances. As I reflect on Belle's journey, I can't help but feel a deep sense of hope for those who are experiencing homelessness in Pennsylvania. Her story, like so many others, serves as a testament to the resilience of the human spirit. It reminds us that beneath every statistic there is a person, someone with dreams, struggles, and untold potential. However, to truly offer that hope, we must look beyond just policy changes. We need to shift our collective mindset, to stop viewing homelessness as a distant societal problem that can be swept under the rug. It's not just a numbers game, it's about people. Belle didn't become homeless because she wanted to. Her story, like so many others, is filled with loss, hardship, and a series of unfortunate events that piled up one after another. But she also shows us the power of human resilience and the impact of a community that offers its support. Her journey is a reminder that if we as a society take a compassionate approach to homelessness, one that sees people for who they are and not just as their circumstances, we can help them rebuild their lives. But the steps we take, investing in affordable housing, making mental health and addiction services more accessible, and fostering collaboration between government agencies, charities, and communities, are steps toward change. Every person who receives the help they need has a chance at rebuilding, at finding hope, at starting fresh. The journey to ending homelessness isn't just about policies and statistics. It's about the people whose lives hang in the balance. We must remind ourselves that these are human lives we're talking about, and every effort we make, no matter how small, can create a ripple of change. We all have a role to play, and together, we can help make that hope a reality. If this video resonated with you and you found it insightful, we'd love for you to like, comment, and subscribe to our channel. Your engagement helps bring more awareness to critical issues like homelessness, and together, we can spark meaningful change. The conversation doesn't end here. Let's keep talking and sharing ideas on how we can work toward a brighter, more compassionate future for all. As we look to the future, it's essential to reflect on our roles as individuals and as a society. How can we truly make a difference in the lives of those who are struggling? What can we do to ensure that homelessness is no longer a widespread crisis, not just in Pennsylvania, but across the entire nation? We must all ask ourselves how we can contribute to the solution. Whether it's through supporting local initiatives, advocating for better policies, or simply showing kindness, every action matters. Ultimately, we have the power to change lives, but it begins with a collective commitment to understanding, empathy, and action. When we stand together, there is no limit to the impact we can make. Let's not wait for change to happen. Let's be the change.